everybody. I think it's about time to start. Thank you, everyone, for joining us today. We're having our webinar, Making the End User Experience Personal with VDI. This is one of the webinars in our Coffee Break webinar series. And today we're going to discuss about how to set up your virtual user desktops with a favorable user experience. And as I said, my name is Amy Leopold. I'm the Product Marketing Manager here at Forward Advantage, and I'm going to be moderating the webinar today. There are a lot of people on the line, so we have everybody's phones muted. If you have a question, you can enter it in the question box on the panel on your screen, and we'll do our best to answer all of those questions at the end of the webinar. We will be recording this webinar, and we'll send it out via email after the webinar is over. So thank you, everybody, for attending today. With that, we'll switch it over, and I'll introduce you, everybody, to our speaker today. And our speaker today is Lee Howard, our Vice President of Client Services. I know many of our customers on the line may already be familiar with Lee, as he is an integral part of our team here at Forward Advantage. Lee has over 20 years of experience in healthcare information technology, and Lee manages the support and services team for Communication Director and Data Express, as well as our Identity and Access Management team. And with that, I'll pass it over to you, Lee.
Thanks, Amy, and welcome everybody for our webinar this afternoon. A quick overview agenda is we're going to hit a little bit about Forward Advantage, where we've been and where we're going. Talk about virtual desktops and challenges for the IT community. And then get to the crux of the matter, is that end user experience that we're looking for and how we get there and why we're going to that direction. Followed by a few customer success stories as well as best practices. And we'll finish up with how Forward Advantage can help you achieve those objectives in VDI. Again, the subject is making it personal because computing is personal to all of us as we spend much of our day in front of a computer. So a little bit about Forward Advantage. Some of you may or may not know. We've been on a journey for about 23 years now. And it really started with a specific problem at a specific hospital, and it was really around physician communication. That journey's taken us quite a ways from where we were back then in 1993 to where we are today, where we're able to provide innovative solutions for healthcare. The number of customers has grown, the market space has grown, and technology has evolved over that time. And a lot of that change has occurred because of our customers and with our customers. We're driven really by our customers' needs and solving their problems as well as the problems that they're solving for their customers, which are end users. So when talking about the topic of virtual desktops and how we get to a virtual desktop, we have to discuss the challenges for hospital IT. We live in a technology age where probably everybody that's on the line right now has their phone either in their hand or on their desk, and so do all of our users. They're using Facebook, they're using their iPhone, they're using their tablet on a daily basis in the consumer side of the world, and part of their expectation is how we integrate that into their work life as well. So really, starting in some of these concepts for IT, it's understanding the expectations of caregivers, physicians, nurses, physical therapists. They're using technology in their everyday life, and their expectations for having it in the workplace are there whether we want to believe them or not. And so supporting BYOD for our physician community is obviously something that's important. And virtual desktops help us achieve that. We're trying to mix that technology that the users are looking for from an experience perspective, along with the constructs of what we have from an IT perspective, making sure that we're protecting the patient health information, the PHI, stopping cyber attacks that are coming in from the outside, as well as managing the cost of healthcare, because as all of you on the line know, there's not an overabundance of capital and operating expenses to put in whatever systems that you want. So making sure we are having the right resources deployed, whether they be technical resources or staffing resources. And again, supporting that caregiver workflow that we're looking at. So quite a few challenges that we're trying to intermingle into the virtual desktop environment, and it all comes out through who we're communicating with. Communication is very important because we need to talk with those customers, nurses, physicians, but not just talk with them, we need to collaborate with them so that they can understand what we're doing for them and with them, because it is a collaborative journey. So speaking specifically about caregivers, and when we isolate VDI, we're really talking about that workflow experience of nurses, physicians, and the care team that's actually caring for patients every day. Collaborating with them gets us to understand something that's on this slide that I'm sure every one of you have heard, how many clicks it takes them to get from point A to point B. They do count clicks. They also count the amount of time things take. And so it's important that we deliver as streamlined a solution as possible, both on the inside of the four walls as on the outside of the four walls. They're not technologists. They don't understand that the virtual desktop is running on a VMware hypervisor. They don't really care. We're just trying to deliver good quality access in an efficient manner for them to work. Their access needs to be fast or rapid for them to be able to start their day and continuing their workflow of the day. On the bottom you see here, we're talking about a little bit about web-based applications and software as a service. Many of us deal with Google Docs, Gmail, or iCloud. That is evolving in the healthcare space as well. Office 365, which many of you may have, as well as Meditech's new web platform 616, Athena from a practice side, EMR on the practice side, is delivered over the internet as well. So understanding that and then mixing that again with our technology, making sure we provide that streamlined workflow. So why does the user experience matter? Their expectations are increasing. They're used to, on their phone or on their tablet, working at home and getting things quickly. But on the other side, we in the healthcare space are requiring and mandating our clinicians to put everything in the electronic chart. All of their notes need to be in the electronic chart. Progress notes, patient intake notes, medication history needs to be in the chart. Orders need to be done electronically. The lab results are electronic, so where do you go get them? You go get them out of the electronic chart. All of that is helping drive the care team, and the care team is not just one person. So as that EMR technology adoption goes up, more and more users are in the EMR. We need to be conscious of that workflow, getting them in and out of that electronic chart as quickly as possible, as efficiently as possible, so that they can do that item on the right-hand side, spend more time with the patient. The care team is not just one person. It's not just two people. The days of the paper chart and the clipboard being passed from person to person, those days are behind us, or we're moving away from them. And if you put yourself in the patient side, which I myself have been, you want to make sure that everything's documented in the chart, from the pre-op visit to the surgery to the post-care, so that everything is known about me as the patient, so that they can deliver the right care for me no matter who the caregiver is at the time, whether it's my physician, whether it's the nurse doing follow-up, or the specialist that my physician referred me to. So we've talked a little bit about the challenges and what our caregivers are expecting. How do we get there? And everybody's going, this is where we want to get to. So with all of it said, it takes a community to help these people. It takes us in the technology space, from an information technology. It takes the clinical analysts to communicate and collaborate. It also takes the caregivers to tell us how they work and what their workflows are. We have here on the slide several items that we should account for as we're delivering virtual desktops, and again, trying to make it a very easy to use workflow for our care providers. So at the top left is the most important one of all, fast access. on initial login as well as reconnects. When we look towards the end of the slides about some customer success stories, we will talk specifically about what our customers are experiencing with those times, because that is important, because time is clicks and is time that they're spending, again, with the patient versus on a computer. Having a consistent look and feel, many people like to have icons on their desktop, some people like to have a clutter-free desktop. Making that consistent experience for them in a very streamlined way so that they can get to the applications, the electronic chart that they need to get to. Making sure that USB devices work. For those on the nursing side, bedside medication, reconciliation and verification, the BMV process, is really integral into patient care in the acute side. And then last on, you see on the right-hand side, is about printing. So we think that the electronic chart doesn't need to be printed. However, there are elements that get printed of the chart, as well as discharge instructions and things for the patient to take care of at home when they're discharged from the facility. The chart's electronic, it's mobile, so we need to arm our caregivers to be electronic and mobile as well. So you saw that click forward, and one of the things that we see being very important to that process is single sign-on, referred to as SSO. In a virtual desktop environment without SSO, the user would log into the desktop, they would launch the virtual desktop client, they would authenticate to it, they would select the desktop pool, and then once inside the desktop pool, they would launch their EMR, authenticate to it, and then begin to treat patients. All of those elements that you see that are lined out in red are things that the single sign-on can automate for them. Simply tapping in or logging in once starts the virtual desktop client, whether it be VMware View or Citrix Zen Desktop. It authenticates them, it selects the desktop pool, and therefore all they need to do is start the application unless they've asked us to put that in Windows Startup. And then they're able to treat patients. A couple other things to note about that process is that when you launch the EMR, and I'll use Meditech as a specific example, you get to the login screen, but from a nursing perspective, they're going to navigate to NUR or PCS, Patient Care System. For physicians, they're going to go to their physician rounding list. That is another click, and it also takes them to that list. Upon reconnection with SSO, we're going to automate that flow. So from an improved workflow experience, they're going to do that startup process once when they begin their shift or their day. And then as they move from the nursing station, where either the nurse or the physician is going to bring up the chart, he might bring up patient Howard's chart, as well as the x-ray that he's going to come talk to me about. He logs out or taps out of that, and then when he enters the room, whether it be on his iPad, or it be on the wall-mounted device in the room, or if he grabs a cart to bring in the room, he taps back in, and he does not need to navigate to my record or to the x-ray that he was viewing. All of that is encapsulated in that virtual desktop, and that helps him or her, as a physician, provide better care to that patient so that they can begin that conversation with the patient about the chart, with the chart present, and focus on the patient and what they need to talk to them about. So Follow Me Desktop with virtual desktops is extremely important, and remember that you navigate to those components of the EMR, which does take time, and again, saving time and clicks. So we've talked a little bit about ways to do that. We've talked about the challenges. So here's 3 separate profiles of customers who have had those challenges and have worked through those challenges. These are 3 customers. There are others, but these give us a good broad range of different environments that have different EMRs, have different virtual desktop infrastructure, have different topology of their networks, and their care settings are different. So I'm going to go through these briefly, but in there you'll see that we touch on all 3 of those elements that we talked about earlier, which is making a fast, convenient access, giving the user a really good workflow experience, and making sure they can focus on the care of the patient. So at Hospital A, they've actually virtualized 100% of their desktops. I mentioned earlier that we talked specifically about login times and reconnect times. Their initial login time for them to tap in and have their desktop for the first time of the day load is about 30 seconds. That includes Windows starting. That includes all of the Windows startup processes. More importantly, though, when they tap out and they go to the next workstation or move on to their iPad, their reconnect time is averaging 6 to 8 seconds. The physicians and nurses are doing that anywhere from 50 to 90 times a day. The average is right around 60. So if you count the time that they're saving, that time can be anywhere from 30 to 45 minutes. And that is time savings that we give them to provide care. For Hospital A, they were printing and having print jobs appear in the wrong location. So with a virtual printing solution, we made sure we got the job to the right location where the user was at that point in time. And probably more importantly, we didn't get the job lost so that it was caught in a stack of other documents so that they could provide that to the patient. Hospital B didn't virtualize all their desktops because they felt it was unnecessary in the clinical environments. But in their non-clinical environments, including laboratory and radiology, there was really no need because the fast access wasn't as important. When they did their time and motion study, and they actually did a time and motion study before and after, focusing on nursing and BMV, they actually estimated that they saved their nurses about 2 hours per shift. They are running 12-hour shifts. Their biggest savings, when they looked at the details within that time and motion study, was the navigation to the patient list, because that navigation can take anywhere from 5 seconds to 7 seconds, and doing that 60 times a day adds up. They also, with single sign-on, reduced their passwords from really 5 to 1, and password help was really important to that facility. So the last hospital, Hospital C, is actually a multi-facility institution, and we're not working just in the acute environment, but also their ambulatory environment. Their physician practices are across the way from many of the facilities, not all, but many of the facilities. So many of the physicians will actually start their virtual desktop in their clinic, tap out, pick it back up on their iPad as they're walking to the acute care facility to do rounding, and will pick that desktop back up. The roaming from ambulatory to iPad, which is remote, to acute is very important so they can keep their lists up so they can know the patients that they need to visit and in what order they need to visit. From a volume perspective, they're actually running currently 5,000 virtual desktops across about 8,000 endpoints, and their endpoints are a mix of Windows endpoints as well as many thin client computers or zero computers at the endpoints. There are other facilities that are doing very similar things, but these three give us a good picture of what it can look like before and after. In all of these, the after saves the care providers time, saves them clicks, and allows them to treat patients. So as I said in the first slide about Forward Advantage, we've been on this journey for 23 years. And in virtual desktops, we've been on this journey for 5 to 6 years now. There was actually a footnote on one of the slides about a time and motion study that VMware actually asked us to do at a facility, and we did that time and motion study. At that point in 2011, 5 years ago, we didn't have all these lessons learned. We learned some of them through the process of collaborating with our customers, which Forward Advantage, that's one of our things that we really think is important to do, is collaborate with you, our customers, because that will help us better understand the problems as well as the solutions. So here's some lessons learned that we've learned along the way. Some of these are from thinking about it in advance, and some of these are from the School of Hard Knocks, to be honest. Probably the one that I would take away as the most important is the communicate early with the clinical teams. I've said collaborate several times as we've been talking today. Collaboration with the clinical analysts within IT, as well as nursing leadership and physician liaisons in the physician office, the CMIO, is important because we want to solve what their problem is and also at the same time set their expectations of what we're going to be delivered within the confines of the current infrastructure, the IT budget, the IT staffing resources. So if we communicate and collaborate with them, we can tell them what we're doing, why we're doing it, and what they can expect. And they appreciate that. They also give us feedback on elements that we didn't know about environments. Involve those clinical analysts early, especially when it comes down to testing the workflows. On the communication and critical component about the workflows, we may or may not know about all of the USB devices that are out there. They may have a scanner attached to certain desks or certain mobile devices for reasons that we're unaware of. They may be taking insurance cards as a rounding enrollment or patient intake in the ED that we might not have known about or thought about in IT. So having them understand what those workflows are and tell us where they have USB devices, where they're going to print from, if they're going to move carts from room to room, if they typically don't use the wall-mounted devices in patient rooms because of their location in the room so they can't collaborate with the patient. They'll tell us what we need to do to modify the environment, again, to get the best workflow for them. In the green tier, infrastructure is important because this is a heavy infrastructure lift for quite a few customers. In doing that, making sure that we size out the storage and compute resources, and also from a management perspective, minimize the number of desktop pools. We don't want too many pools because that's more maintenance. It also takes away from having a consistent look and feel for the end user. When we virtualize the environment, in the case of the customer on the previous slide, with 5,000 desktops, we need to have fault tolerance. In the case that cluster 1 goes down, we need it to automatically fail over to cluster 2. We need to make sure that that environment is fault tolerant. Again, since we're putting everything into that electronic chart, they're relying upon that electronic chart. We need to make sure it's there for them at all times. From an endpoint perspective, the current desktop team, having a number of endpoints that support the workflow, that support the connectivity of USB, but also minimize the different versions and different types of devices that are in an environment. One customer made the choice to go to all-in-one computers, and they wanted to standardize on those all-in-ones because it was a consistent and easy process for IT to replace them. They also, in the process, got 20-inch monitors to their users, and their users were really happy about the 20-inch monitors. So again, consistency from a look and feel for the user, but also for IT to support and maintain. From an optimization perspective, I talked about that 30-second initial logon and 8-second reconnect, 6 to 8-second reconnect. Having single sign-on automates many of those clicks and processes, and that saves us time, and it really becomes a must. There are ways within Microsoft GPOs or group policy objects to refine settings and have icons appear for physicians that don't need to appear for the nursing staff, or vice versa, keeping the user experience very clean and personal. And then last but not least, before we ever get to the point of deploying, utilizing optimization tools or optimization scripts to make sure that that golden image is very clean and crisp to optimize that workflow of the initial logon and the reconnect. So today during this webinar, we've talked about some of the challenges, what the users expect, and some successes we've had and some lessons we've learned along the way. Along this journey, we started with single sign-on from Imprivata. We also implement VMware View. We've also implemented customers that are running Citrix Zen Desktop as well as Microsoft RDS, but we actually offer a VMware View as a solution. Additionally, along that journey, we've partnered with a company called Uniprint for virtualized printing, as well as iGel for thin clients, where we can take Windows XP machines that are no longer supported by Microsoft, and repurpose them with a thin client look and feel that's consistent. So those are a couple of the solutions that we offer. But more importantly, how we can help our customers is collaborate with them. We can do that through different ways, depending upon where you're at in your journey with virtualization and virtual desktops. We can advise and consult you, talk to you about what we've experienced and how to work through that. We can plan your virtual desktop infrastructure from the technical side to the operational side. We can provide architecture, design, build from the ground up. We can also implement the solution and work with you shoulder to shoulder to do that. And if you already have one in place and you don't feel it's running optimal, we can come in and provide some optimization and remediation services. If you go back across that journey, we actually started in virtual desktops doing optimization and remediation for customers as we were finding that their virtual desktops were not clean, their logon processes were taking too long, and we weren't getting the best performance. We actually started there, and from there the journey led us to customers telling us, hey, you should look at actually helping people plan and design from the beginning. And so really we've taken that from that approach. Again, customer focused. So why Forward Advantage? We've been exposed to many different customers, everything from the customer B or hospital B, which is a single facility, fairly small, to a multi-state IDN, which was customer C or hospital C. We're exposed to those different environments. So we get to see, and from my engineering team, they get to see different environments and what they've gone through, as well as understanding those subtle nuances of the Meditech EMR. Specifically, Meditech Magic versus Meditech Client Server versus 6X versus their new 616 web platforms. Not only can this work in the acute environment, but it also can work in ambulatory clinics. And understanding the workflow is different in the clinics than it is in the acute facility. We can deliver everything from point-to-point solutions from the beginning to the end to just helping you along your journey however you so need us. From a certification perspective, we have engineers that are certified with VMware Horizon View, specifically virtual desktops. We have engineers that are Improved certified as well, Microsoft partner certified as well, and then we do actually have, that's not on the slide, a few Citrix certified engineers. So at this time, I'm going to pass it back to Amy, our moderator, and we're going to take some questions from the audience. We hope this was helpful, and thank you for your questions. Amy?
Great. Thank you so much, Lee. That was great information about VDI, and we're hoping everybody on the line was able to get something out of our presentation. We do have a few questions that look like coming in. The first one is, how many desktop pools do you see at a typical customer site? Thanks,
Amy. That's a good question. I actually hit on it in the slides. Typically, we actually see 2 pools for clinical users, and specifically there is a separate physician dictation pool, whether it's Dragon Nuance or Dragon Medical One or another dictation system. And the reason for having a separate pool for dictation other than the other clinical users, nursing, PT, OT, RT, etc., is that we need to give more resources to that pool from a CPU and memory perspective, and we need to assign it that way. When we do assign it that way, we use a single image management process. So it's the same image, but we do a delta to allow there to be 2 pools. So keeping it to 2 pools will help you from an IT management perspective, maintaining it, as well as testing before you take a new pool live. So typically, again, 2 pools, 1 that's segregated for dictation.
Okay, great. So the next question is, how does physician dictation work within a VDI environment?
I just mentioned dictation, and there the question comes. So it is something that we have to consider and test and test and test. So there's a couple areas to understand from a technology layer perspective. Storage and compute, we need to have more of it in the desktop itself. Also, USB redirection, how we have that configured. Again, we're doing that typically in a GPO or GPP. If the driver can be baked into the image, Dragon Medical One has one that we can bake in. And then resource allocation, but probably most importantly is to test that workflow, especially when it reconnects to the USB-powered mic. USB-powered mics, specifically talking about Dragon, are very important because the powered mic reconnects very well. It also dictates at a quick clip inside that desktop. So resource allocation, baked-in driver, and USB redirection.
Okay, great. And the next question then is, what are the biggest issues you see at customers as they begin a VDI project?
That's a good question, somewhat a loaded question too as well. Understanding the technology layers that's going to be put in, specifically on the infrastructure side. This is not server virtualization, so it's different in that perspective. So having enough storage and computing it out to have not just the capacity for the number of desktops you need, but also overflow usage of desktops. So scoping the infrastructure, as well as technical proficiencies within IT. It operates on some of the same tenets of server virtualization. However, server is run at an expected clip. Desktops have users that make things different. They may start up streaming apps that we are not expecting or anticipating. We need to anticipate those. So understanding that from a storage and compute as well as a scope of IT services and IT skill sets. And then last but not least, understanding the endpoints, what we're going to have in the endpoints. For people that have no VDI infrastructure availability, the storage and compute lift can be a decent sized lift. So understanding that going into the project is very important.
Okay, great. Thanks, Lee. Looks like we have a couple more. The next one is, can you have multiple Meditech sessions open in a VDI environment?
So yes, you can. Inside the virtual desktop, applications run as applications run in Windows 7, Windows 8.1, Windows 10. So you can just double-click and launch the application 2 times, 3 times. Many care providers do. The caveat to that, so in Meditech Client Server, as well as Meditech 6X, well as in Meditech 616 Web, they can just do that with inside the app. For Meditech Magic customers, there is a subtle nuance that needs to be taken care of in the terminal dictionary so that you can run multiple copies of the Meditech TE, the terminal emulator, underneath one host name, and you can do that in the terminal dictionary. We will usually size how many are going to run per desktop so that we add that plus a few just in case. So yes, you can.
Okay, and the last question is there a preference between Citrix and VMware?
So I'd like to say yes because we implement and sell and support VMware. However, really it's dependent upon your organizational need. Many customers have Citrix, a legacy Zen app environment that they can bring forward and save themselves on licensing, so we understand that. So again, it depends on your organizational goals, and we work with customers in both environments, and we can get them to do the same thing. The technical lift is a little bit different, but it depends on your need as an organization.
Okay, great. So thank you so much, Lee, for taking those questions. That's all the questions we had come in today. And as I mentioned before, though, everyone, we did record the session, so we will be sending out a link to you so you can review it at your leisure or share it with any of your colleagues who may be interested. And we do have quite a few webinars still coming up in our Coffee Break webinar series. Feel free to sign up at any time. The sign up is available at forwardadvantage.com. So it looks like we have 4 left and some great topics on those as well. Okay, everybody, thank you so much for attending today. Here's our contact information. You can always reach us via email or give us a call, and we're happy to answer any questions that you have. Thank you again, and have a great day, everybody. And this concludes our webinar.